I'm getting the COVID vaccine because I want life in this country to go back to what it was before this disease devastated this country. I want my parents to be able to go outside again. I want my children to be able to go to school. I feel like we've been adrift after a shipwreck, and this is the lifeboat that's been thrown to us.
It's such a positive moment right now for everyone that's been working so hard through this challenging journey as we as MedStar Georgetown, as we take care of all those that come to us in this crisis moment. And it's hopeful. It's hopeful that we'll be through this. And it's also especially important because this is a moment where we're taking care of our healthcare heroes, caregivers, those that support our caregivers as they run into harm's way selflessly. This is another way for us to keep them safe. It's a special day. It brought the science together. It's a safe day, and it's a hopeful day. I'm very proud of MedStar, of our 30,000 associates. It's allowed us to care for more COVID patients than any other organization in the region, while also taking care of the needs of our non-COVID patients. It's a special day, a positive day, a hopeful day.
I'm taking the COVID vaccine today because it is the right thing to do to protect myself, my family, and my community from this devastating virus.
The team is really up for this task. We've been actually drilling for the last week on how to do the vaccines, doing both running sort of a slow walk of preparing for it, tabletop, and then we've actually been doing sort of little drills along the way of how we're going to do each step of the process. So the team is up and prepared for it and able to get all their questions answered before we get to the front of the to actually giving it. So as we gave it today, they were actually all prepared of how to do it, knew exactly what to expect, and there was no.
I'm taking the vaccine for my own personal health so I can continue to care for the patients in this hospital and this community. I think the side effects, if they happen, are short-lived and trivial compared to actually getting the disease, as well as the long-term side effects that we're still learning about today.
The vaccine is a hot commodity, and we're kind of on the front lines taking care of patients. I felt that it was important for myself and my family that I get vaccinated since I'm exposed often taking care of patients. I'm sure there's a lot of questions and concerns, and I think that's warranted, but I think it's important to take advantage of this opportunity and getting a vaccine so that we can get on with our lives and get healthy and get over this pandemic.